Okay, today is Saturday, March 21st, and I'm in a park in Beijing, kind of like their Central Park. It's as big as Central Park, maybe bigger. And I know that the US is bracing for the storm now, and I just wanted to encourage you guys, you're going to get through this. You just need to do like China did, basically. You can beat this. You don't have to get infected. Stay away from other people. Doesn't mean you don't go shopping or get your food, but basically get rid of all those other activities that you don't need to be doing. I do recommend wearing a mask if you have one when you're in public. And yeah, you can reuse it. It's not the ideal, but when you're in short supply, it's better than nothing. Even the WHO has it on their website that you can wear a mask, that it does decrease respiratory spread. And that means don't hoard them. It is true the healthcare personnel in the United States need that's in low supply. As you can see, there's a fair number of people out today. We have relaxed a lot since the beginning, and you will too. Epidemics don't last forever. But for right now, I think that maybe you can just look at me as an example of where you're headed, that it will not last, epidemics don't last forever, spring will still come, and things will get better. But for right now, isolation is not a bad thing. And the majority of people, you can stop this spread by just not congregating, taking it seriously, and helping the healthcare workers by doing that to keep the numbers down. Otherwise, too many people get sick at the same time, not able to take care of the patients. Okay, so to my medical colleagues, please organize yourselves within the cities. Each hospital should have a hospital within a hospital, ICU within an ICU. Here in China, not every clinic is allowed to see fever patients. You need to organize where the fever patients are going to be seen, which hospitals are going to be the infectious hospitals. And then within those hospitals, decide who's going to which hospital is going to fill first, second, etc. You need to be organized. This is the key. I don't think the United States is so good at organizing itself locally. I suggest, I'm a surgeon, there is a trauma surgery protocol. I suggest for the surgeons to use that trauma network to organize the hospitals. The trauma network is already established. It'll have somebody in any place that's doing trauma, and that way trauma goes along with ICU, correct? So use the trauma network to organize the ICUs. I'm going to put some links to some of the helpful things maybe you find. I'm going to show you about the 7 points that the CDC from China brought out about how to handle fever patients. Please protect yourselves. If you look at the WHO site, this guy's he's flying a kite. The WHO site actually says to healthcare workers, you know, ideally you have goggles, mask, gloves, gown. Then if you can't have all of that, you can have at least gloves, mask, eye goggles. If you can't have all that, then at least focus on the mask and the eye protection. And if you can't have all that, if you can't have a mask at all, then a face shield that goes from ear to ear and covers down to your chin is better than nothing. And even the WHO on their website recommends that you have a homemade mask if you can find nothing. So a homemade mask could be made out of cloth, or they say bandana. What you can find is better than nothing to my healthcare colleagues. Or I would even suggest that to other people. The reason is, if you can decrease people coughing, and to see if you can see you can decrease source control. If the person coughing, nobody plans to cough. So if you can put something over your mouth, keep yourself from coughing, or cover the respiratory droplets from spreading when someone does cough or sneeze. Again, this can go on surfaces. We think that soft surfaces like your shirt maybe just last a few hours. Hard surfaces can last days. Nobody knows exactly how many days, but it can last days on the hard surfaces. It's up to 7 days, and I'll try to get a PowerPoint picture on that about how many days it will last according to the surface. But we know at least on surfaces it lasts days, and on your clothes we think just hours. I do, working in the hospital, I separate the clothes I wear in the hospital, and I will wash those separately from my other clothes, and I'm a little bit more careful. I'm purposely showing you walks in the park to let you know that this park was absolutely closed a couple months ago. Nobody was even allowed to come in, and now you can see 8 weeks into this, then we're coming out again. We're okay. People are okay. So you too, you're gonna get through this. You just gotta take it one day at a time. This guy, he's really like the expert. He's got this whole big reel with his kites, and his kites are so high, I can't even see them. They're so high up. Let me see if I can show you. You probably can't see them. They're so high up. I'll just show you the smaller kites. I don't want you to panic. I'm perfectly fine. I worked in a hospital. We just made sure that the patients who had fevers were completely separate from the rest of our hospital. And again, not every hospital in the city should be seeing fever patients. They should be sent to organized places to go. And the local hospitals or government needs to be doing that. If they haven't already, they need to be doing it now. And in small towns, you need to organize yourself and decide who's going to do that. It shouldn't be everybody's clinic. You need to shut down those things, and you need to do ICUs and ICUs. If you don't have protective wear, a face shield mask that covers ear to ear down to your chin is what's recommended by the WHO. You're going to get through this. Spring is still going to be there. Epidemics never last forever. It's going to be a rough few months, but again, we can do this, but we have to do it together. Love from China, Dr. Michelle Savu. Thanks. So this is the entrance to the park. You're still not going to get in the park if you have a temperature. So they're going to take your temperature before you come in. They're going to make sure you have a mask on. Then they're going to let you come in. But you do get to come in. Traffic's just about picking up. These streets were empty 4 weeks ago. This is how it happens. It's a progression. It goes one stage, next stage, next stage. You guys are the beginning stage, the tough stage, but you're going to get through it.